most famous physical therapist on the internet.
Wake up, Brad. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, how to eliminate shoulder pain. 5 top shoulder impingement exercises.
Say no more, Bob.
And I think these are the top 5 in the world, in my opinion.
Well, of course, in our opinion.
It's humble, but by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free. We upload every day. Also, yes, you want to join us on our social media channels because we are giving away, what are we giving away? The wall anchor? Yeah, we're giving away the wall anchor. We'll be showing this later on. You're going to want to have one if you have a shoulder problem, but even if you want to do any fitness in your life.
Absolutely.
So go to bobandbrad.com, go to the giveaway section.
Yeah, get back over here by us.
And you can sign it up. And it's also on Bob and Brad Facebook. And if you're tired of us going on and on the way we do, go to Twitter and also Instagram. We get a short version of this every day.
Yes. For those of you impatient people with don't like old men babbling on about
that's
this
right.
and that.
All right. Are we going to talk now, Brad?
Oh, yeah. That's the shoulder problem.
Yeah.
So, right. We've discovered these over the last few years, and from research and then actually working with our patients and, of course, ourselves.
Myself, I'll tell you, Brad and I just were having this discussion. I tried everything. I knew, and my shoulder pain wasn't going away until I did a couple of these.
Okay. Now, I want to go to the next point. This is the first one.
Right.
Is this book, which we did. We got this book referred by a viewer.
Yes.
Wrote a comment. They said, this book.
We listened.
So Bob took the initiative, ordered it. We both read the book, and we're both self-treat and treat our patients with this.
First, very skeptical, wouldn't you say?
Oh, absolutely.
I was like, I wasn't buying it.
Yeah.
I was like, that didn't make sense. I mean, it made a little sense, but I mean,
exactly.
didn't think it would work.
So it's simply hanging.
Yeah.
You hang from a pull-up bar.
He calls it brachiating.
And this is from Dr. John Kirsch, who's an orthopedic surgeon, and he's actually from 30 miles from my hometown, which I thought was kind of neat.
Yeah, great minds apparently coalesce in the same area.
There you go. It's a Wisconsin thing.
Yeah.
Anyway, so we're going to go through, if you have impingement, the brachiating, the hanging actually helps take the acromial coracoid ligament and stretches that and opens up the space so you don't have that impingement. So you just go to a pull-up bar like this, and we have an option if you don't have a pull-up bar, so just hold on for another minute or so.
Yeah.
And I just started doing this one again because my shoulder was bothering me from swimming. I didn't have my pull-up bar in my basement. There's a long story to that, so I put it up last week. And this is all I do. And it's also can be good for your back as well. Put some traction.
And you don't even need to lift up your legs. You're up on your toes.
No, I mean, I can, but I don't need to.
And it can be rough on your hands. And so he would recommend a lot of times wearing gloves.
Right.
So
yes. I typically hang for 10 to 15 seconds. I think in the book he recommends up to 30 seconds. My hands get sore, and I find that I do fine. But then I do that 3 repetitions. I relax, do some exercises, then I come back, and I involve it with my whole routine.
Gotcha.
With my banding. So that's a simple exercise. Shall we go on to
the next one? Yeah, I thought weren't you going to use the chair?
Well, of course, but we're going to use the booyah stick. You can use anything that's about 4 or 5 feet long.
I thought the booyah.
Oh, yeah.
Booyah! Booyah! Okay. All right. Now we're happy.
Yeah. Just a little thing we do for fun.
That's
you don't
right.
have to do that as part of the treatment. But you take the stick. You want to do it standing? Because you can do this standing or seated.
Well, you're talking about this way?
No. This is the Statue of Liberty.
I know. But so I have to sit down or get on my knees, you mean?
No. You do it here. Remember how we...
Oh, I know. Yeah, okay. I thought I was going to do it sitting on this thing, but
Good thing we rehearsed this one.
Yeah, that's right. We're really wanting to go here.
So you can do the standing or sitting.
You can find a countertop.
Yep. And if you don't have a booyah stick, use a stick that you can grab good. And
like a broomstick or a...
Yeah, and it can't slip, though. If it slips around, do something so it doesn't slip. And you reach up as high as you can. And then you get a good grip on what you're on the stick, and you simply lean forward, and it stretches the arm just like it does when you're hanging on the pull-up bar. And you're just doing one. I don't think it works as good is a pull-up bar, but if you don't have one,
I think it works pretty well. I do this every morning.
You
when I do it, Brad? I did it this morning. I stretch my calf muscles on the steps.
Yeah.
I put these on the steps above me.
Oh.
And I stretch like this while I'm stretching my calf muscles for my run.
So that would be like doing two things at the same time.
I've been doing that. I've been doing double stretches on things.
Oh,
and
good.
It just so I'm, I stretch the one calf, I stretch the other calf, I stretch both calves, and meanwhile I've stretched the shoulder out by the time I'm done.
There you go. So look at that. We got options there. So typically you're going to hold up to 30 seconds and do that about 3 repetitions. And you do this, all of these you're going to do daily. If it hurts your shoulder, if it creates pain, it may not be ready for it, or you may have a different diagnosis, and then stop doing it.
Yeah,
don't carry on.
This is not something that we're doing that no pain, no gain. You don't want to have, I mean, you can have some stretching discomfort, maybe a little bit, but wait, am I showing the chicken wing right now?
Oh, yeah. So the other thing, just a hint, impingement, typically symptoms are, it's pain-free down here, but when you start to lift your arm up to around 90 degrees or up higher, then it hurts. Sometimes it'll ow hurt, and once you get up here, then it doesn't hurt anymore.
It can be a painful arc, as we call it, or it can be painful at the end.
Right. If you want to do tests, we do have some really good videos on how to test for shoulder impingement.
Very common, by the way. I mean, I would say the vast majority of patients I see, 80% probably have some form of this.
And that's cited in Dr. Kirsch's book as well.
Is it really?
Yeah.
He concurs.
He concurs.
Okay, so I'm going to show you the chicken wing.
Oh, yeah.
So with this one, and what you're going to do, you need a pole or a stick.
I'll show from this direction.
Okay. And the upper arm, that's the good arm.
Yep.
Okay. And the palm is down or forward.
Thumb is pointing down towards the floor, or whichever way you want to think about it.
On the bottom arm, the palm is pointed out. Okay. And this is the shoulder retreating, the bottom one. Now, the first couple of days, you might just do internal rotation like this, bringing it up and down. You're bringing the arm up. But then eventually what you want to do is bring it up and actually stretch it out this way too. And you got to watch out for your head. So you got to go to the side of the head here. But I just do pressure on, pressure off, pressure on, pressure off. And again, I think this was a miracle, Brad. I mean, when it was just such an irritating pain, it was getting to the point it was hurting all the time.
But when you did this, it didn't.
It did not hurt.
It felt like just a stretch.
It just felt like a stretch, right?
Okay.
It did
so
not
it's important that you get that kind of a response.
I get the sense, Brad, that you don't believe in this exercise as much as I do. But again,
well, it's because we're actually, it's not like Bob invented this. You got it from a combination from two famous therapists, from McKenzie and
Mulligan. Yeah, sure.
Mm-hmm.
So,
all right. And now we're going to go to the old strengthening exercises that this has been going on in physical therapy for as long as there's been physical therapy, I believe.
Yep. And you want to, this is to help maintain and keep you out of trouble. Did you want this yet?
Yeah, we're going to do some rotator cuff strengthening of the posterior muscles, which help keep that the caudal glider, that humeral head down, so you avoid that impingement of the tendon.
We should mention, Brad, this is what we're giving away. We're giving away. These are the clips that go on the wall. This is the wall anchor. You get 4 of them when you go from our website. We invented it. We were definitely looking for something to easily attach, the
bands,
the exercise bands, and
so that's about as easy as you can get.
But there's a whole bunch of variations you can do so it doesn't slide through. And anyway.
So this is how you're going to do it. You put a towel here by your elbow, and what that does is that keeps your elbow in the proper position, so you get the proper mechanics.
And he's got a right angle here.
Yeah.
And he's not breaking that. Yeah, he's not going up.
It's not this, and it's not this. If the towel drops, that means your elbow went too far away from your ribs.
The flying elbow.
Yes. So it's here, and you're going to do 10 of these. And then after you get done with 10 of those, you're going to do the last exercise, the 5th one, scapular retraction.
So what he's doing here, you can see the shoulder blades are coming together. A great postural exercise. You're establishing the muscle base for the shoulder.
Great.
Because if this is winging on you, the shoulder is not going to be stable.
Right.
and it's going to impinge a lot easier. So posture is really important, even with shoulders.
Yeah,
In fact,
absolutely.
especially with shoulders.
Right.
So you
So
really want to make sure that your base is established.
so and you don't have to have that towel in there. Once you get the mechanics right,
Sure.
you can do 10 of these, let it rest a little bit. Then I have my patients go right to 10 of these, and I say, put your hands down into your, like you're putting your hands in your pocket, and tell them the visual about the where the scapulas go. Where you
Well,
should
yeah.
use.
What the idea, what you think about is that the shoulder blades are actually going down and in the opposite pocket. Yeah, and now obviously you can't do that, but that's what you want to think. It's just kind of gives you the visual of where you want those blades going
That way, the right muscles contract, and you get
and
the
are working.
yeah, so you get most efficient. And then I do like to say 3 sets of 10 of these with my patients. So 10 here, 10 here. I'm not going to go through them, and then that would be 1 set, and you do 3 sets. Are you tired, Liz?
Now you literally you probably don't have to do that every day. You could,
Right.
yeah, but if you got that in 3-4 days a week, you'd be doing well.
Right,
So
right. So there's 5 of them. We don't recommend you do all 5 of them. Do the ones that give the best symptom relief. Let's put it
that's
that way.
right.
If you do one and it just hurts it, and if you're really flared up, you may have to put cold packs on it and do the Codman's exercise, which we have a video coming, I think, tomorrow on that one. Or
Is
the
that
next
on?
day.
Is that when it's coming up?
It's coming up pretty soon.
All right. Well, it won't be by the time this one comes up. It'll be up already.
Oh, that's right.
So, all right, Brad, I'm gonna give a golf lesson now. So you keep the
Oh.
towel underneath the arm like this. 'Cause when
Why,
it comes like this, you
Bob?
don't want the towel to drop. You want to keep it connected to the
This
body.
is not one of
So,
the 5.
all right. Thanks everybody for watching.